Turning to the first panel session of the event, we will provide insights into the lessons and opportunities that arose resulting from the COVID-19 pandemic whilst fighting against malaria. It is my pleasure to welcome the following speakers to join me in this discussion. We have John Fairhurst, who is the head private sector engagement at the Global Fund to fight HIV, fight AIDS, tuberculosis, and malaria. We have Dr. Robert Newman, Director of AMP Health and former Director of Global Malaria Program. We have Olivia Ngou, who is the founder and executive director of Impact Santé Africa and Civil Society for Malaria Elimination. We have Scott Gordon, Director of Malaria Vaccine Implementation Program, PATH. Thank you, our esteemed panelists, for joining us today. So I will start the conversation with John. I know at the keynote session, we had an overview from Peter Sand on the report, a new report by the Global Fund, which shows that COVID-19 has massively disrupted health systems and health delivery in around HIV, TB, and malaria in low and middle income countries. But it didn't really go into details. We would like to hear from you get more information regarding that report. What did you find that were the main reason for the disruption of malaria services? How did it impact progress? And what are the most important next steps in addressing global malaria challenges? Over to you, John.
So Chuka, thanks very much for the intro, and pleasure to be here. Thanks for the event. I think it's, as many of the panelists have said, really fantastically timed in terms of reinvigorating and pointing us towards what we need to do on malaria in particular, and a great initiative to bring private sector and public sector together. So thank you. Yeah, I mean, in terms of the report, I think Peter referenced it to some extent. It was a snapshot report. It covered 500 facilities across Africa and Asia in the sort of third quarter of last year. Public and private facilities. And I think it really reinforces what we all know, is that the impact of COVID has been huge. And also that it will continue to reverberate in 2021 and likely into 2022. And that we shouldn't underestimate how serious this is. I think the other thing, though, and it's easy to forget this and looking at the negative, but it points to the immense resilience and dedication of people to maintain the services. And while it doesn't paint a nice picture, I think we would have been in a much worse position if it hadn't been for all of the hard work and the investments that many people on this call have made in the past. What it showed was a 17% decrease in malaria diagnosis in Africa, a 15% decrease in treatment. It also really shockingly showed that 1 in 5 facilities don't have anti-malaria medicines for children under 5, which obviously is a huge potential impact on the mortality rate. And this is in spite of all of the effort, that people have put in to adapt and maintain services, despite the challenging circumstances. There are many reasons for why this has happened, and I think many of them will be very familiar because we've all felt some of these. In terms of the facilities, reduced services were a key factor. Partly the shift in focus to COVID-19, the reduced stocks and supply chain impacts of and challenges there through the system. More patients being redirected because the capacities were reduced. Patients having to travel further for treatment maybe as well. And actually a big increase in patients with respiratory symptoms, which to some extent isn't a surprise, of people coming to facilities, but really creating a sort of overload of facilities not necessarily able to cope with that. And the consequence of that, of course, is the double whammy, that the backlogs of not being able to treat people means that you also then have to run twice as hard to keep up with yourself in the future. And then lastly, the information campaigns, which are really crucial in getting people the right information, were overwhelmed in some cases by C-19, and also sometimes the the clarity of the recommendations was confusing to people. And then for people, I think many of the things we've all felt, the sort of fear, the uncertainty, the risk of going to get treatment in the context of COVID, transport being disrupted, lockdowns obviously had a big impact when they were put in place in many countries. And then people making decisions to delay care, which affects malaria, affects HIV, it affects many spaces. So, a really broad set of circumstances, which I think in a way points to how serious this is. And then the last thing, which I think Peter and others have referenced really clearly, is that the COVID was also undermining one of our core assets, which is health workers. And if we don't have health workers in facilities, we don't have health workers in communities, and they aren't safe and they don't feel safe, then it clearly has an impact on how people access health workers, but also, how health workers themselves, get sick, and the consequential impact on already compromised systems. So the survey shows something like 45% of health facilities did not have enough essential protective equipment for health workers: masks, disinfecting gloves, sanitizer. So the dedication of health workers to provide services, of course, is fantastic. But they really have put themselves in harm's way in a way that we shouldn't be comfortable and accepting. What it did show is that countries that adopted adaptive measures did better, and therefore the disruption was smaller. And I think this is one of the lessons for the future that we need to think about. Something like 2/3 of the facilities surveyed adopted these adaptive measures, giving long-term dispensing of supplies for things like HIV and TB, switching to door-to-door delivery systems for preventative malaria medicines, and they really did better in minimizing the disruption. So I think as we think about the future, I think there's some clear messages on top of all the things that people on this call know around how we deal with malaria. So I won't, emphasize the fact that we need to do all the things that we know that deal with malaria, and in many cases we need to do more of that. I think one of them is that we need to deal with COVID. If we don't deal with COVID, and we don't get the balance in dealing with COVID and dealing with all the other things that are affecting people, then the systems will become more exhausted, and however resilient they are, it will have a longer term impact. So the cumulative damage will continue to grow if we don't, make sure we get equitable access to vaccines, we don't get diagnostics and therapeutics and protective equipment to people that need it. And many of the global mechanisms, like ourselves, our COVID response mechanisms, C19RM, the ACT Accelerator, are not fully funded. We don't have this global ability to support countries to the extent we need. I think the second thing is to look at the adaptations and make sure we scale those adaptations where they're relevant. And some of them were probably overdue, and COVID has maybe accelerated them, but we should definitely learn from what's worked and make sure we do that. The third thing for me, I think, is around information. And C19 has shown that you can have daily information on a pandemic. And why don't we have that for malaria? Why aren't we driving malaria and the ambition for malaria information to be much more real time and live? Clearly, health workers, we know their core. This has brought them to be very central to this. We need to protect and support them, as many others have said. And then the last thing I think is the private sector plays a really fundamental role in malaria treatment. It's 70% of the fever diagnosis in Nigeria, and high in many countries. It's really important we make sure that they're engaged to provide quality services, that they're providing the data from that service provision. Because if we can work with them providing 70% and support them to be effective, we'll go a long way to dealing with the crisis and in eliminating malaria in the future. Thanks very much.
Thank you. Thank you, John. I'm glad you mentioned the last component, the private sector. we all know the role the private sector plays, and I'll come back to you with a question on that as a follow-up. My next question goes to Dr. Robert. Just in line with what John said, COVID-19 has exposed various shortcomings in our health system across Africa, impacting life-saving malaria programs, as he mentioned, referring to the Global Fund report. But what were the main issues identified, and how would AMP propose to develop stronger leadership and management for community health as an important step to preventing similar disruptions in the future? Dr. Robert, over to you.
Thanks very much, Achuka, and thanks very much for the opportunity to be here for this important discussion today. Yeah, I think picking up on a few key points that have been said today, of course, things have gotten worse for malaria, and COVID remains a threat. I agree with all those things, but I also agree strongly that things could have been far worse than they have been. And, there's been some real bright spots, massive number of bed nets distributed, a couple 100 million bed nets distributed in the midst of COVID, 30 million people reached with seasonal malaria chemo prevention across the Sahel. These are really tremendous achievements. I think it's also really shown that community health is the linchpin. Facilities may close and people may be afraid to go to a facility, but if they have access to community healthcare in where they live and they trust that person, that's great for making sure malaria services aren't interrupted, and it's great for making sure that people with COVID are actually reached as well. And they really are the linchpin, I think, for so much of what we need to do across Africa, of course, for diarrhea and pneumonia and in the future for non-communicable diseases. But I think that I sort of have two main messages today. One is that, while we're doing wonderful things with community health, we're sort of guilty of magical thinking. We don't invest nearly enough. The main vertical disease programs, which I've spent much of my career working on malaria, have not invested sufficiently in community health systems. And we need massive new investment. It needs to be in the vertical disease programs, but needs to go beyond that. And I think we really need a visionary push for investing in community health services and community health workers, and professionalizing that force and really making them a key piece. Countries that have done that, I think, have shown the value and success in doing that. And so, I really think that that's a key message out of today. Peter Sands referred to that the community health workers have been a bright spot, but how are we going to do that? How are we make sure that this, funding window for the Global Fund right now gives clearer guidance to countries that they can spend those resources on community health systems and community health workers? Right now, I think that's not sufficiently clear to people. The second thing, and this goes back to my malaria days, when I was director of the Global Malaria Program, and I thought we were doing pretty great with, bed nets and spraying and diagnostics and drugs. And I had a moment of realizing, but we weren't investing in the people responsible for these increasingly complex programs. That I knew malaria control programs that had been run by 6 people when they were $100,000 programs. And now it was the same 6 people running $100 million programs. And frankly, we haven't made much progress in that. I started speaking about that in 2010. This is more than a decade later. And we still think somehow that, that these leadership and management skills are gonna sort of happen by magic, but they require major investment. And that's the reason I came to AMP Health is that I believe that we need to invest in leadership and management skills of healthcare workers nationally and peripherally across different programs, national malaria control programs, community health programs. And that, we can support governments to build visionary and effective teams, right? And it's not picking out one person and sending them off to a course. It's actually embedding people, coaches and mentors to work with whole teams to develop those leadership and management skill sets. It's only teams that have those skill sets that are going to be resilient in the face of adversity, that are going to be able to face crises, that are going to be able to embrace innovation, manage change, and take advantage of all the other partners. I'm not saying government should be doing this alone. Ministries of health can't do this alone, right? Many partners are required. The private sector is critical. But my experience is if a ministry team doesn't have the leadership and management capabilities to know how to bring those partners into orbit, then those partners remain left out of the equation. And And this requires massive investment, right? Leadership and management is not a quick win, right? This isn't, a couple weeks. This is years. But if we really want to reach the goals for malaria, we want to reach the Sustainable Development Goals, we want to defeat COVID, what's really required is leadership and management. And there, the private sector also has a key role. The private sector does a great job of investing in the leadership and management skills of its workforce. And that's the sort of thing that we need to do in the public sector as well. And some of those skills, some of that mentorship should actually come from the private sector. When I hire people to go into ministries of health to be management partners, we call them, mentors and coaches, we bring them from the private sector because that's where people have that skill set. Governments have great technical skills. I don't think they're short on technical skills, but it's the leadership and management. I'm a physician. I didn't get leadership and management training in medical school. And the same is true across ministries of health across Africa. Right? You see people who've been promoted for their technical skills, not because they have leadership and management training. So again, I think that if we can make sort of the twin pillars of investment of sort of massive investments in community health systems and massive investments in leadership and management capabilities, those I think are the twin pillars that are going to allow us to both continue the road to eliminate malaria country by country and ultimately eradicate it, and also to defeat COVID and whatever other pandemic threats are out there waiting for us. Over.
Thank you, Dr. Roberts. Yeah, your last sentence actually captured all that you said so far. Invest in the twin pillars of community and leadership. We agree that leadership has a huge role to play in the fight against malaria, even across other disease areas, and it's very important that we focus on this while we're trying to get to our desired goal. My next question goes to Olivia. Dr. Robert has talked about communities, and we've heard a number of speakers talk about health workers, but we also know that the civil society has a role to play and must be involved in all stages of response to health crisis. How is civil society for malaria elimination responding to COVID's impact on malaria? Olivia, over to you.
Yes, so CS4Me members, and really thanks to the great contribution of civil society members that are engaged in malaria, that are part of CS4Me, they were able to quickly react to the COVID-19 pandemic and to mitigate the impact of malaria in their community. So first of all, what they did is that they create and adapt measure to fight against COVID-19 in their community, by producing their own mask, by sensitizing community on hand wash and also how to wear mask, and also how to adopt all the COVID-19 behavior. In addition to that, what we did at CS4Me and Impact Santé Afrique, we have developed a tool for civil society organization on how to address malaria issues in the COVID-19 context. So how to prevent malaria and how to ensure a proper malaria case management in the context of COVID-19. So we produced this tool in collaboration with WHO, with UNICEF, and partners of the Ministry of Health in Cameroon, but it's a tool that can be used in many countries. So what we did, we also trained civil society member of CS4Me on how to use that tool, and it was supported by Fondation France, which is a partner. So this tool explained very well the difference and the similarity between malaria and COVID-19, what to do in case of fever, if it's what to do also in case of a confirmed malaria case or in case of a confirmed COVID-19 case, and really how to also make sure that communities, health workers, civil society continue to sensitize and engage community on malaria issues safely in the context of COVID-19 by respecting the mesure barrier. So the tool has all the critical element on what to do differently and better in this context of COVID-19. So civil society organization did a lot of activities at the community level to sensitize door-to-door communities around the importance of continuing to sleep under mosquito net to continue to prevent malaria, to go to the health center with the first sign of fever, because we know that the mosquito won't wait for COVID-19 to pass, and it's very important that the community remains really engaged during this pandemic of COVID-19. So I would like to just conclude by saying that the role of civil society was is still very, very critical in this COVID-19 pandemic, because sometimes in some area, civil societies are the only relay and the only people that the health system has to reach communities that are the hardest to reach. And that should be very much sensitized about not only COVID-19, but also making sure that they are safe from malaria during this critical time.
Thank you for that. We are so grateful to the work that the community health workers are doing and the civil society. We are grateful that the pandemic has not prevented the amazing work you're doing, and we hope that you keep on doing that, and that we have more investments to even support the work you're doing and increase the reach of the civil society and the health workers therein. Scott, one of the most talked about topic in recent times is the malaria vaccine. We've even heard during the keynote session and even during the fireside chat, it was talked about. The malaria vaccine, especially in the face of COVID-19, the discussion has been very, broadly discussed. What learnings do you think we can leverage from malaria programs to benefit the effort against COVID-19 and vice versa, including from the ongoing pilot programs implementation of the world's first malaria vaccine in 3 African countries? Scott, please throw more light on this. Thank you.
Sure, thank you. Well, first, my sincere thanks to the organizers of this event and the panel. It's a great opportunity to speak with you today. So in answering your question about the learnings that we can leverage from the malaria vaccine program, and particularly around COVID-19 and vice versa, maybe I'll first talk a little bit about the malaria vaccine and then draw some links between malaria and COVID-19. So to set the stage, RTSS is the world's first malaria vaccine to have shown efficacy against malaria through rigorous large-scale trials. These included trials conducted in Nigeria, in Jos and in Ngou in 2011 and 2012, as well as the pivotal phase 3 trial that was conducted at 11 sites in 7 African countries between 2009 and 2014. These trials demonstrated the efficacy and the acceptable safety profile of the vaccine, and led to the 2015 positive opinion by the European Medicines Agency and recommendations for the pilots by the World Health Organization. So today, as was mentioned earlier, the RTSS malaria vaccine is being implemented by ministries of health in parts of Ghana, Kenya, and Malawi through a large-scale pilot program that's coordinated by WHO and funded by Gavi, the Global Fund, and UNITAID. And PATH is a lead implementing partner in this phase introduction. And over the past 2 years, more than 1.7 million doses of the RTSS malaria vaccine have been administered and are benefiting more than 650,000 children across the 3 countries. So in reflecting on your question, I think 3 lessons have really become clear since the launch of the vaccination with RTSS. The first is the importance of subnational or micro planning within the countries. The second is the importance of community engagement and communication to really build trust and mobilize support. And finally, with challenging diseases like malaria and COVID-19, we really have seen that one of the keys to success is the integrated use of multiple interventions and not one approach alone. So as we think about the importance of subnational planning and touching upon some of the importance of leadership and data that Robert mentioned, both malaria and immunization programs have increasingly shown that approaches need to be based on local data and tailored to local conditions. Although one-size-fits-all approaches can have an early impact, they tend to miss critical and particularly vulnerable populations. Malaria vaccines, we've heard and we know, have the potential to reach millions of children not reached by other malaria interventions. However, we have to know where those children are and how to reach them. And leaving pockets of unreached populations impacts not only the equity of the programs, but has a significant impact on our ability to control vector-borne and infectious diseases. So using good data at the service population level and target interventions is essential to ensuring that the local populations are reached. And our ability to monitor progress and reach, whether it's through improved immunization registries or through tools such as ALMA's malaria scorecard, really is critical in that regards. The malaria pilots have also highlighted the importance of community engagement and communications as a critical tool to build and maintain community trust. During the past 2 years, we have seen efforts to undermine confidence in vaccines spread through online platforms and in some cases through the media. And the key is really to be prepared and be proactive in engaging with community members, community leaders, and other stakeholders, and to be comprehensive in the planning and the use of communication tools that deliver accurate information. As I've heard from Peter Sands and the other members today, community health workers have been critical to the success of the pilots, and they play a key role in building and maintaining community trust in both malaria and immunization programs. Providing healthcare workers with the tools and the resources they need to communicate about malaria, the malaria vaccine, and now the coronavirus vaccine has been critical to maintaining that trust and building acceptance of these interventions. That built trust is a truly valuable asset for the programs. Trusted healthcare workers are not only more effective in helping prevent the spread of the virus by encouraging prevention and care-seeking behaviors, but they also themselves are protective against rumors, fear, and misinformation. Finally, in malaria, as in COVID-19, the availability of tools is only part of the solution. They don't have impact if they're not taken up by the end users. And so we know that a third key lesson is that health measures need to be combined or layered on top of each other to really achieve impact. With RTSS, the vaccine's impact, both in the clinical trials and now in the pilot introductions, has been shown in combination with other interventions, bed nets, diagnosis, treatments. The immunization and the malaria programs continue to stress the importance of continuing to use other malaria interventions, even as children are receiving the malaria vaccine. And we continue to evaluate RTSS in the context of those other interventions. We see the same need in the response to the COVID pandemic, using multiple tools as they become available, rolling out the vaccine, even as we encourage communities to maintain infection control and preventive behaviors. And the pilots have shown the value of combining the tools and expertise of the different programs as well. The collaboration of the malaria control and immunization programs in Ghana, Kenya, and Malawi have been critical to the success of the pilots. Cross-programmatic technical working groups have been central to the implementation of the vaccine as a core element of both program strategies and as a means of strengthening linkages and the overall strengthening of the primary healthcare system within all three countries. And as we look at Ghana, Kenya, and Malawi, we can also see how those program linkages have contributed to their resiliency in the face of COVID-19. Although the pandemic has impacted all three countries, like the other countries that John has referenced in the study, they have leveraged their strengthened community health systems and their communications as a core resource for their COVID-19 response, and for maintaining other routine health services, such as routine immunization and malaria control activities, even while they are responding to the virus. And in engaging their communities around both malaria and COVID-19, we have seen all three countries' ability to tap into the reservoir of trust that they've built through that effective communication. So here I just have to say something about the importance of continued investment in research and development of new and improved tools as well, as is the case in both malaria and COVID-19. As Dr. Kalu noted today, and as the director of the WHO Global Malaria Program, Dr. Pedro Alonso, noted earlier this week, new tools, such as vaccines, are urgently needed to get back on track and to reach key malaria targets. And we know how important R&D investments have been in the case of COVID-19. In addition to R&D investments themselves, there are other critical supportive investments that are needed. And in that regards, partnership with the private sector is critical. And so I would also like to acknowledge this past 15-year partnership with ExxonMobil and their support of filling information and evidence gaps to drive and develop and deliver malaria vaccines. Those types of public and private sector collaborations really are key to moving things forward. So the bottom line, I would say, is what we've learned is that there's no single solution to either malaria or COVID-19. But we do have increasing opportunities brought about by combining new tools, continuing to focus on how we can use the data that we have to tailor those interventions to the local populations at the local levels, and continuing to focus on building community trust through communications and engagement. And those really have been very salient lessons from our experience in the last 2 years with the malaria vaccine. Thanks.
Thank you, John, for this call for the lessons learned. There's a lot that you've shared so far. I'm sure the audience are taking note, as I am as well. So at this session, we will open the line or the chat box for the audience to bring in your questions. I want to encourage the audience to bring in questions that they would like the panelists to respond to. While we wait for them to bring, we already have a couple of questions that have been responded to already. But while we wait for more questions to come up, I want to ask John this question. I mentioned the private sector. Scott also mentioned the private sector. We all know that no one sector can do it alone. Now we know that the private sector has a huge role to play in the fight against malaria and even across other diseases. So my question to you, John, is how has the fund utilized its relationship with the private sector to drive impact in response to malaria? And how can we ensure continued collaboration? Share with us, John.
Thank you. Yeah, well, I know we're running behind time, so I'll be brief. But I think Scott and Robert both referred to particular areas that are of interest. In the context of the Global Fund, one of the key areas that we've engaged very, very concretely and significantly is around procurement and around making sure that we can access high quality supplies in malaria at affordable prices, and I think that's really crucial to use the economies of scale in the relationship to really drive the best availability of the best products. I think also to Scott's point, to really accelerate the new tools into the market. We have some work at the moment. We're partnering on the vaccine implementation, but also new bed nets and making sure that they also enter the market as effectively and rapidly as possible. So there's a whole space there that I think is really important. I think the second place, and it's often overlooked, is in the sort of delivery side. So really strengthening the systems that allow us to deliver more impact, reach further with our impact. And here, Robert spoke to the role of private sector in building capacity in health systems. I think that's really, really powerful. The model that AMP has. There's other areas. We have a partnership with Rockefeller, which is using funding from the foundation to look at the last mile of the data system. How do we make sure that when we're building information systems, we're building it last mile out, not first mile out? And very importantly, that data is available to workers, to community health workers and clinic workers, to inform how they make decisions is really critical. So using the skill sets, using the financing to really innovate new solutions where the private sector takes risk is important. And then aligned with that, bringing technology companies. So we're working with MasterCard, Microsoft, Google, and others, which is really about bringing their skill sets in data, building data systems, data analytics, using new innovations like machine learning, I think is really powerful. And then another space is around the supply chains, and these are fundamentally important for us to reach, for medicines and supplies and commodities, bed nets to actually reach people effectively. And here we have partnerships with people like Coca-Cola in a long-standing partnership we have called Project Last Mile, which has really been working to sort of, in essence, support government, bring private sector skills to logistics, supply chain management. And we've seen things there where they've increased accessibility of core sort of essential commodities by 40% in countries through the capabilities they bring. So these sort of partnerships that bring the technical skills are fantastic. Obviously, the partnerships that bring catalytic financing to really drive change and innovation, I think are also really powerful too. So those are just some examples, I think, of where it can be really helpful.
Thank you so much for that, John. So I have a question for Scott. What progress have we made in the malaria vaccine? And what are the next steps in getting the vaccine out? I think it's very important. People need to know you've already talked about what the malaria vaccine is about, but we need to know where we are in terms of rolling it out. What are the next steps? And in terms of, please share with us findings from the vaccine program regarding safety, interest from people, and acceptance of the vaccine, because this is very key. Okay. So go ahead, 2 minutes max. Thank you.
Great. Well, it really is an exciting time right now as we're approaching World Malaria Day. And it's also worth noting that tomorrow, April 23rd, is the second anniversary of the launch of the RTSS malaria vaccine through routine immunization programs in Africa. So it's a very exciting time for us right now. And as I mentioned earlier, we're 2 years into the pilot program. We have more than 1.7 million vaccine doses that have been delivered. More than 650,000 children are benefiting from the vaccine. And as the three countries, Ghana, Kenya, and Malawi, are implementing the vaccine, we're working with African researchers to gather the evidence on the vaccine safety and routine use, its impact on mortality and life-threatening severe malaria, and the feasibility of providing the vaccine through the routine immunization programs. And so these insights will inform a WHO recommendation on the broader use of the vaccine across sub-Saharan Africa. And we expect global advisory bodies for immunization and malaria to convene this year in October to review the data that's been gathered to date and consider whether to recommend the wider use of the vaccine. So if that recommendation is positive, it really will pave the way for the financing decision by the donor community, for example, Gavi, and for vaccine adoption decisions by malaria endemic countries in sub-Saharan Africa. So, of course, we have the data around the vaccine from the clinical trials and that were conducted over more than a decade. And we know what those have showed around the efficacy and safety of the vaccine. So what I can say about the pilots is that safety really has been the number one priority of the work that we've been doing within the pilots. And that the reports of the Data Safety and Monitoring Board are issued quarterly as they continue to review the safety reports, and they continue to work with the national regulatory agencies in all three countries. And what they found is these data safety reports have continued to be positive. The safety in the routine use is positive and is a key aspect of the malaria program. So we know that we are seeing that the vaccine is safe in broader use. And we see that feedback from surveys in all three countries are indicating increasing confidence in the malaria vaccine at the community level, and that the community themselves are really excited about the vaccine. And parents are overwhelmingly saying that they want the vaccine, they would accept the vaccine for their children if it were offered. So we are really excited about the review of the data this coming year and the potential for a broader recommendation.
Thank you, Scott. I'm glad we have good news all around. We look forward to having the vaccine soon. Let me emphasize on that soon. So finally, one last question for Robert from the audience. Which strategies could be used to increase engagement participation of women and girls in the rural area? I know that AMPs are well invested in community work. So Robert, can you share any insight on that?
Yeah, no, thanks very much for the question. It's a very good one because I think, historically, leadership programs have often focused on men. They're in positions of power, and the structures have maintained that. I think that one of the things that's very important in leadership and management is actually overtly addressing the issue of gender. How do we make sure that people are aware that unless we break that cycle, unless we create equal opportunities for women and girls and start that very early, that we just perpetuate the same power dynamics that we have today. It's one of the reasons that while we started our work in health and we're still AMP Health, we are in discussions with ministries of education about the same sorts of leadership and management programs, because we don't feel that these are actually specific to one sector. My feeling after a lifetime in health is that one of our failings in health is that we think all the solutions come from within health. But in fact, many of the solutions to the things we want will come, for instance, John used to work in nutrition. We can't talk about nutrition without talking about ministries of agriculture and ministries of education. The same if we want to increase the leadership opportunities for women and start with girls, we need to work with ministries of education. And in fact, we're in discussions with one ministry of education about how we might actually support the leadership and management skill development of the division of girls' education, right? How do we start early? How do we make sure that there's an overt plan on how to build up the leadership skills of girls and then young women? And then when we get to the point of looking at programs that are for civil service, how do we make sure equal access and that we really are prioritizing the development of leadership skills, not just national level, but also peripherally? And let's face it, at community level, a lot of the leadership that we're seeing is from women, and we need to figure out how to continue to support that going forward.
Thank you, Robert. Your word in caps, equal access. Women and girls, and in general, we should start thinking about that. I'm glad there are a lot of conversation around that already from different organizations around the world, and I hope that we will achieve something, in terms of creating equality around in all facets of our lives and in all units, in all sectors, as we go forward. So I want to say thank you, a big thank you to you all, our panelists. You guys have been amazing. Thank you for your valuable contributions, and I wish we had more time, but we're running out of time. But your contributions have been very immenseful and helpful and noted, and will be very useful in our work towards malaria elimination. So we will take a short break and be right back with our panel 2 shortly. Thank you. Bye.